My name is Ramin Nilforooshan. I'm consultant psychiatrist for all the adult dementia specialist and professor at the University of Surrey. And I've been PI and CI for many dementia trials. I think it divides in two parts. One is assessing, and then the second one is about managing and providing care for people with dementia. If we talk about assessing first, I think in many centers, psychologists work alongside with psychiatrists or neurologists, and their role is mainly about doing the assessment at the early stage. And so many people, when they score on a borderline on some of the memory tests, for example, they score 83 or 84 in ACE, or maybe even higher, and the clinician, they feel that the memory test is not helpful to confirm a diagnosis, then they refer for detailed neuropsychometric test. And psychologists, some of the psychologists that they work in this field, they're expert in doing detailed testing and identify the area which the person deficits. And by doing a detailed testing in each area, for example, in executive functioning or in immediate memory or long-term memory or recall or recognition, using different batteries, then they could look at the person. They look at the specific of the person, their background, their education, their age, and then they put the current memory test on a graph and see at what percentile they're on. Because the normal memory test that is done in a clinic, it's a number and it's not personalized to this person. But by doing a neuropsychometric test, you could do a personalized memory test related to this person and compare this person with other people in the population and say, yeah, for example, in short-term memory, they're scored less than 25 percentile, which is low for this person. They also do a premorbid IQ, which is helpful, and then they compare the current memory test with the premorbid IQ. So if someone had a good previous premorbid IQ, but currently the memory is low, then there is some condition is going on. Regarding the care, I think the role of psychologists is very important, and it comes at the later stage of dementia care. The role of psychologists in providing dementia care is different from the role of neuropsychologists who are doing the assessment. So assessment is at the beginning of this pathway, but then later on, many people with dementia, they present neuropsychology symptoms such as agitation, aggression, irritability, hallucinations, and many other symptoms which is related to dementia. And I think it's the role of psychologists are very important in assessing the person and see what type of care is required. Currently in NHS, psychologists only involved in providing that type of care if the person is admitted to a dementia ward or if they are admitted to care homes and then have a care home pathway. So what happens when a patient admitted to hospital to a dementia ward, and majority of the time, the person with dementia admitted to a dementia ward because they present with severe agitation, aggression, or other signs or symptoms that is not manageable at home. When they come to hospital, the role of psychologists are very important. They will assess the person, they will talk to all the staff, they will see the person and see their background, do a data gathering about what type of person or what was their behavior before they had dementia, and then using all those information to provide a map, to provide a better care for this person. We call it positive behavioral support, and in NHS now, PBS, it's well established. It means maintaining the well-being of the person, engage in activities, and also doing routine things for the person to enjoy their life. It may sound very simple, but in many centers, if they do not write things down, then they don't know how to engage with this person and what to do with them. For example, if a person was previously an outdoor person and always out and wanted to go out for a walk or something else, if you admit them to hospital and keep them in a room without any care planning that they have to be taken out for a walk of an hour or 1 hour, they get very agitated. Other way around, it just if the person was an indoor person, always like reading book or watching TV or doing some activities, it has to be in their care planning and understanding them. Understanding the language that they used before having a dementia and after. Also observing them, talk to healthcare assistant that they constantly see the person and see what do they react to. Some people, they like their hand to be held. Some people, they like someone sit beside them and talk to them. Some people like music. So writing a proper plan for them will help other staff to provide a better care. And then reduce use of medication. We know that using antipsychotic or benzos may help at some point, but increase the risk of falls and dehydration. And then therefore, if person had a fall, the outcome would be much worse. So if we could reduce using any unwanted drug, then that would be the best care that we could provide those patients.